Hi, everyone. My name is Christina Singh, and I work with Neighbors Together. You're watching our page, you're watching our Facebook, you're hopefully on Instagram with us. And we are, for those of you who don't know, Neighbors Together is a soup kitchen and community center located in the heart of Brooklyn, in Ocean Hill, Brooklyn. And our mission is to end hunger and poverty in some of the lowest income areas in New York City. And during this pandemic, during COVID-19, we have been really trying to keep all of you updated on our work and what we're doing right now and all of our efforts. And so we've started this new staff interview series called This Week at Neighbors Together. And I really am so grateful to have our campaign manager, Annie Carforo, here with me this week to chat about what we're doing and continue the conversation about what we're doing in our community action program. If you have not watched our first 2 episodes, which Amy's interview was 2 parts, so I guess it's technically 3 episodes, but please head to our YouTube page. We're just Neighbors Together on YouTube, and you can watch them on YouTube, and you can see what's been going on in our cafe and some of the outline of how our community action program has changed over this time. But really encourage you to go and watch that and see the state of what's going on at Neighbors Together and what's going on during COVID-19, because our models have changed so drastically, but we're still here and we're still so dedicated to making this work happen. So Annie, thank you so much for popping on with me this week. I'm really excited to talk to you about your work in the Community Action Program. Can you quickly just explain what you do in the Community Action Program? If that's framed kind of before COVID-19, that's totally fine. I just kind of want people to understand what you work on.
Fair enough. Yeah, thank you for having me, first off, and thank you for everything you do to set this all up. So I am the campaign manager in the Community Action Program. And in the Community Action Program, we're working on a number of different advocacy campaigns. So we're focused on different issues within the housing world that are affecting our members. And so my job as campaign manager is to make sure that all of the day-to-day work involved in those different campaigns is being handled and completed, and making sure that our members are, informed, educated, up to date with what's going on, are helping make decisions, and are helping drive the direction that Neighbors Together goes in. So, one thing that Neighbors Together, it prides itself on is that we are member-led, and that means that our members are in every step of the decision-making process. And so it's a lot of coordinating. Before COVID, it was a lot of meetings and gatherings and trying to get lots of people in the room so that we could talk about issues that are affecting all of us and work towards solutions. In this post-COVID world, it's a lot of phone calls, a lot of check-ins, a lot of, Zoom for some of our members who do have that capacity, and keeping them involved in policies that are going to affect their lives and the lives of thousands of New Yorkers.
Yeah. Well, I definitely know you are a busy bee at Neighbors Together before COVID, and you've definitely been busy after COVID. So when we were talking to Amy, we talked about the Homeless Can't Stay Home campaign that has really been birthed from the COVID-19 crisis response, or lack thereof in some areas for the homeless population. Can you give people who are watching this for the first time just a quick overview of the Homeless Can't Stay Home campaign and how that came to be?
Yeah, absolutely. So, organizing is really hard work, and organizing people who are experiencing homelessness is, an additional challenge on that, because people who are homeless, their lives are really unstable. The Department of Homeless Services in New York City does not make things easy for people who are staying in their shelters. There's a lot of moving around, of lost belongings, people come in and out of contact. And so Neighbors Together was one of very few organizations that our membership base was primarily experiencing homelessness. And so when COVID-19 hit and the city started to shut down, we instantly knew that, this was going to be a much harder and this was going to be a bigger challenge for our members, because they don't have the resources necessary to social distance, to self-isolate. And we have seen historically DHS not being the best caretaker for their clients. And so right when the city started to shut down, The few advocacy organizations that do work with people who are experiencing homelessness, we, pretty instantly got on the phone. We're sharing information, what we were hearing from our members, issues that were coming up. And we learned really quickly that there was no plan in place for anybody who was in a congregate shelter. And a congregate shelter is a dormitory style shelter. So they can have anywhere from 4 to 20 people sleeping in one room. And everybody we knew who were in congregate shelters were telling us they're not moving us. We've run out of hand sanitizer already. This was like mid-March.
Yeah.
Nobody has masks. Nobody has gloves. They're not doing anything. And so we started to raise the alarm bells because, nobody else was going to be bringing this to light unless advocacy groups were raising these issues. And so we very quickly started our coalition, excuse me, and it's made up of, I believe, 8 organizations. So there's Neighbors Together, there's Vocal New York, there's Communities United for Police Reform, there's Human NYC, who primarily organize street homeless individuals who have their own individual sets of problems happening right now that we'll probably talk about later. Landlord Watch, and Urban Safety Net activists at Urban Justice Center, and Picture the Homeless. So that was kind of how we started, and we formed a list of priorities based on what our members were telling us, and that ranged from access to food to access to somewhere to safely socially isolate or socially distance, to ending the criminalization of homelessness, because that has been a really dark stain on our city's record of policing people who are experiencing homelessness and essentially criminalizing them because of poverty.
Right.
And so we kind of made our list of priorities, and from there, the most urgent one was definitely to get people into isolated spaces where they could stay safe from this virus. We were hearing about, spread throughout the congregate shelters that was not being addressed. People were telling us, men in my, shared room were coughing throughout the night and they're still there. People are leaving and then new people are coming in and I don't know like where they've been or who they've seen. And so that became our rallying cry, was to get all New Yorkers who are sleeping in congregate settings or on the streets into individual private hotel rooms without roommates. Because again, if you have a roommate, you cannot take responsibility for where they're going and their actions. And so you are inevitably at risk.
And people who are being potentially housed in the roommate, they have no idea who that person could be that they're being housed with either.
Yes, and that can lead to a whole other array of problems. Imagine not knowing somebody that then you have to isolate with. We've heard, some of our members who were forced to do that, it's really hard to get sleep because different sleep patterns, different respective space, and it has led to like a lot more stress than it should when you're moving into somewhere where you can like potentially.
Oh,
what was I talking about?
We're back. So okay, we had
Apologies.
Where Annie unfortunately had some internet issues, but we're back.
The woes of
we're
remote
talking
work.
about when people are living with a roommate and there's different sleeping patterns and some issues that can pop up with that.
Yeah, it can cause a lot more stress. And what we've also, from advocacy work, I think that's really important to understand that sometimes governments can make decisions without consulting the people that are going to be directly impacted by those decisions. And so when they make these choices, they're not making them with the people who are going to be affected in mind. And they tend to not work then because you're not responding to the needs of the people that need help.
Right.
And from talking to a number of street homeless individuals, they would decline a hotel room if they knew it was shared, because there's a real lack of sense of trust. They don't know if that person's going to go through their belongings. They don't know who this person is. Yeah. And we felt it really important just on a public health level to make sure that everybody had their own private room.
So with the Homeless Can't Stay Home campaign, we did talk to Amy, and thank you for that beautiful overview. We did talk to her about the then inaction around this and the creation of a GoFundMe to help house members in hotels. And the narrative that has been popping up consistently from the city and from the mayor's office, that when people who are street homeless are being approached, or people who are in congregate shelter are being approached, that they don't want help and they don't want services. Can you talk about that narrative and how that is not true, and what we're seeing through the campaign?
Absolutely. I think, anybody that maybe watches the mayor's press conferences will hear him say, people who are street homeless, when our outreach workers offer them services, some people are not ready to receive, to accept those services. And, he always will blame it on either substance abuse or a mental health issue. And, if he took 20 minutes to talk to some people on the street, the reason so many of those people are declining services is because they know what the services are. They've already accepted them in the past. And for people who don't know, those services are, we'll put you on a bus, we'll bus you down to 30th Street Shelter, which is an intake shelter. And so for folks that might not know this, 30th Street Bellevue has a notorious reputation for being incredibly dangerous, incredibly violent, incredibly crowded. And so many people, especially now during COVID, do not want to accept resources where they're going to be put at risk by getting put into a really crowded shelter. And so they deny these services out of, I guess you could say, experience of knowing that the services I'm going to get are not going to help me in my situation. And so, the mayor refuses to admit that the resources that he's providing people on the streets are way below what adequate, would be like what you would consider adequate. Yeah.
So, and we're seeing that through this founding of this GoFundMe account and the funds that we've had to raise because of the inaction, and we've seen this need be so present. That narrative that you just so beautifully outlined is just not true, and we're seeing people accept these hotel rooms very willingly when they're private spaces, correct?
Right. So, we started raising money on GoFundMe. We have over, I believe, $80,000 now, which is amazing. And the mayor's narrative is that some people on the street are stubborn and don't want to accept services. And every single person that we reached out to and offered a private hotel room to, they accepted. And the mayor, this is a big pushback from the administration and from providers that they believe that it will be more dangerous to put individuals into private hotel rooms without services. And what we continue to say is, we're not saying don't provide services. You should, if you're putting people into private hotel rooms, there should definitely be check-ins. There should definitely be some sort of support. But on the flip side, we have put 28 people now into private hotel rooms with virtually no services. This is just a GoFundMe run by some advocacy organizations. And they are all doing so much better mentally, physically, emotionally. They thank us every day. They've shared their stories with us just to try and show that not everybody living on the street requires intensive services. They need a place to stay that's safe and warm and dry.
Right. I mean, there is this stigma that we're also dealing with around the homeless population, that there is this overwhelming need for mental health services, for services in general, which there is this need. But what you're saying is that actually the biggest form of healthcare that we can give to people right now is just straight housing, and we can figure out, okay, there are people who need services within that movement,
exactly.
Right?
Exactly. The housing first model has been studied for decades and has been a proven and effective method for moving people out of homelessness, especially chronic homelessness. And the housing first model is exactly what you said. Get people into the housing first and then help them with the support that they need next. Yeah. And unfortunately, I guess we have an administration that just does not believe in science or fact. I know I've repeated this, but I do want to just say it one more time. A majority of the people who are sleeping on the streets right now have tried the shelter system, and the shelter system is very inadequate, is all I would say. And I think for anybody that wants to question that, if you tried to spend a week inside the shelter system, I would then want you to come back and tell us, would you rather continue your stay in the shelter system, or would you choose the streets? Because I think the decision becomes a lot less clear once you've really experienced what people have to go through.
So there's been so much resistance to this this movement of housing homeless New Yorkers that we have had City Council taking action by presenting a bill. And I know we talked about this in our episode with Amy, but I know the Speaker of the City Council, Corey Johnson, and then Councilman Stephen Levin have introduced a bill, Intro 1927, to push and then find that basically legality of housing homeless people during, and people living in congregate shelter and on the street during this time. Can you talk more about that bill and where we stand today with that bill? When it was first introduced, I know our ask came in early April for this movement of housing homeless New Yorkers. And then we had this bill introduced. Can you talk about when that was introduced and kind of the evolution of how things are now?
Absolutely. So I think, a tactic in organizing is you need to understand who your targets are, and your targets are the people who can give you what you're asking for. So our target since the beginning, when we, started pushing this demand, was always Mayor de Blasio, because he was the one that had the ability to, overnight essentially say, I'm going to open hotel rooms for New Yorkers who can't socially distance. And we were putting a really high pressure campaign on him, and we're realizing that we were just not getting anywhere. He had dug his heels in. And when that happens, because we live in a democracy, we have another branch of government that does have some say over the executive. And so we turned to City Council to look at the potential of passing a bill and making it law that anybody in a congregate setting or on the streets needed to be moved into a private hotel room. And I think something that gets lost in this is this is first and foremost a public health bill. Right. Every doctor that you ask will tell you, and we have, letters from doctors calling to move for our demand, signed by over 500 professionals in New York City. Every doctor will tell you that the only way to contain the spread of this virus is to socially distance and to socially isolate and to quarantine if you've been exposed. If you are in a congregate shelter, you just simply can't do that. And with the amount of asymptomatic spread that is happening that we don't even know about yet because this virus is so new, there's no way for us to declare that congregate settings are safe, even if you're testing every single day, because that was the mayor's response. When we said move people into hotel rooms, he said, test them. If you get tested in the morning, you could get exposed in the afternoon. So we knew that that was not going to be an adequate response, especially considering the size of New York City's congregate shelter system and street homeless population. So our bill was introduced. There was, a lot of drama with this bill because the administration really did not want this to happen. They vehemently opposed it, and they opposed it to the point that once it was released and it was public, they started calling council members. They started calling individual council members and spreading, at a rapid fire pace, I think faster than any of us expected or could react to, misinformation about this bill. They, pointed at cost for some council members. They said that this bill is going to cost DHS $750 million if we pass this. When the truth is, back in March, the state was approved by FEMA to depopulate congregate settings, essentially. Right. So FEMA approved New York State for paying for these hotel rooms. And we saw in California about 75% of the costs were paid for. And New York City also got a lot of funding from the Emergency Solutions Grant. That was the ESG funding that was released in our first stimulus package. That funding would have covered the remainder of the money that this bill would have cost. So while the administration was saying $700 million, the actual fiscal impact statement was $9 million a month. So
that's including the coverage of this emergency crisis funding that was offered to the administration even before the Homeless Can't Stay Home campaign made this initial ask. And the mayor had been ordered by the city health commissioner to get people out of congregate shelter and into safe spaces so they can socially distance. So that's what you mean by that net cost.
Exactly.
Yeah.
Thank you. Yeah. Please clarify if I start throwing out terms. But I think, you know what, every person with a medical background was basically green lighting the city and
Right.
telling them, depopulate your congregate shelters because this is just not safe in this particular crisis with the virus that we have, that's airborne, that spreads so easily, that we know so little about.
Right.
So, you know, they really pushed the cost narrative, which was just a lie and pretty easy to break down, but they got to council members first. They also, there were a number of providers that also reached out to council members along with the administration saying that they believed that this was going to be really unsafe for for some of their clients to be put in private hotel rooms. And this is a really frustrating argument because it continues to stigmatize people who are experiencing homelessness as all of them having mental health issues, all of them having substance abuse. It also insinuates that somebody who's experiencing homelessness can never live independently and that they will always need to be in a congregate setting where they're being supervised. And that, I think, is really insulting for people who are experiencing homelessness because, you know, anybody can become homeless, particularly in New York City. It is,
and particularly right now. And you know, this is a time where a lot of people are being faced with the prospect of, you know, being a low-income New Yorker and being homeless in a pandemic. And so I do think that is spot on what you're saying. It is insulting to the population that we work with and very different from what we see at Neighbors Together.
Exactly. And I think it's important to note that we were never calling for no services.
Right.
We were calling for absolutely, you know, provide check-ins, provide meal times, provide like mental health support, provide case management. People want to move into permanent housing. They don't want to move back into a congregate shelter. Mm-hmm. But we just felt that there was no sense of urgency in the response. It really felt like the administration believed that homeless lives were expendable, that some people were going to die, and that was just reality. And, you know, I think the other really valid point is that right now in homeless shelters, COVID-19 is the #1 killer. So there are, you know, I don't want to push a stigma, but there are overdoses in shelters every day. They're not talked about because they're in congregate settings. If they're in private hotel rooms, yes, there will still be overdoses. But the reality is that right now, COVID-19 is way more dangerous of a what's that word? Can't think of that word.
Well, it's much more dangerous in this setting than other factors that we're talking about. Yes. And I would love to ask you where, you know, you've outlined the pushback and the action that the administration have taken against this bill that is really aimed to provide a public health solution and healthcare to people and a safe space for people to socially distance. Yes, we absolutely agree people need these services, but it's at a time where they need this first and foremost to be able to be safe and have their lives be safe and safe. So after this action from City Council, where does this bill stand and how are we moving forward?
You know, so unfortunately, a lot of their initial outreach has worked. We are having a harder time, you know, convincing council members how necessary and life-saving this legislation is. There's been a decent amount of opposition, particularly to things that we've debunked, like costs, like services. And it's a little bit harder when you're playing defense with the narrative the way that we are right now. We've also gotten pushback from council members who don't want to see hotels disproportionately distributed around the city. So, you know, a lot of low-income neighborhoods bear the brunt of our homeless crisis. They are the sites for the majority of homeless shelters, and they don't get the money to provide resources that are adequate for these people.
Right.
For the way that for the number of people that they have experiencing homelessness, they don't get the appropriate resources. And so there is a mistrust that the city is going to put, most of these homeless shelters into lower income neighborhoods and then not provide the money to give the resources that is necessary. And so, we've gotten pushback on that, and we've tried to show through maps of hotels in New York City that the majority of hotels, the vast majority, are in financial districts like Long Island City, like Lower Manhattan, like Times Square, like downtown Brooklyn, where there is a lot more, unequal wealth distribution and resources available.
Yeah.
So, right now there's a stated meeting next week. And a stated meeting is important because those are the only meetings that bills can be voted on. And this bill is an emergency response bill. So there's, there's a need to get it passed as quickly as possible. And so we are working to really try and help council members understand how important and imperative this bill is just for moving our city forward and for opening. Yeah. If there are settings across the city where there are 100+ people in the same room, outbreaks are going to happen regularly.
Yeah.
And we're never going to fully be able to open safely because homeless New Yorkers are our neighbors, they're our coworkers, more people than I think, folks understand are experiencing homelessness. And if they're not safe, then none of us are safe.
Right.
And so, we have an uphill battle right now, but we're hopeful that, we can continue to fight. And just whenever these pushbacks come up, we really want to center it with some of our incredible leaders who are right now experiencing homelessness and are in congregate settings and are not safe. They can speak so well to why we need this bill better than any of us can. And so just making sure that their voices are not silenced in this time of, really ugly politics.
Yeah, absolutely 100%. And that's been the goal throughout this campaign and throughout our work at Neighbors Together, like you were mentioning at the top of this interview. I wanted to go back to something you said around having more than 100 people in a room at a time right now. Is that happening around the city? Where is that happening?
Yeah, so, the city, I think whether we pass this bill or not, in a lot of ways, the Homeless Can't Stay Home campaign has won, a lot of our demands. We've forced the mayor's hand on a lot of his response to COVID and homelessness. So the mayor, thanks to our pressure, he did start a de-densifying process. That's what it's called. And it essentially, his plan was to move 1,000 New Yorkers who are in congregate shelters a week into hotels until those shelters are de-densified to the point where people can socially distance.
Yeah.
Never mind the fact that all of the bathrooms, the dining halls, the, areas for recreation, the recreation areas are all shared spaces. So there's never actually really a way you can completely make them safe, but that was his initial plan. And so we've seen some of the larger shelters start to de-densify, meaning people are being moved into hotel rooms, exactly like we asked. But there are still very crowded shelters. We see it at Bellevue, which is at 30th Street, that intake center I was mentioning before. Ward's Island has a number of very large facilities, and they are still really crowded. There are, other smaller facilities where maybe only 50 people are staying, but are still really dense. There's no way to socially distance.
Right.
And yeah.
Oh, sorry, go ahead.
No, go.
Well, I think something that I really wanted to, because you outlined all of this, and it is so unbelievably disturbing that these things are happening in the way that they're happening, and we've been making this ask since early April, and now we're getting into the end of May, and there still haven't been, there have been some moves, and like you said, we have won in certain areas, but there hasn't been this big movement like we've seen in other places that have received funding. What can people do, because we have this stated meeting next week, what can people do to ensure that you know, if you're watching this video and you want to take action and you want to help this bill move forward and help your homeless neighbors be housed during a crisis like this and get out of these really dangerous, unsafe environments and be able to safely social distance just like we are, what can people do right now to really help in that way?
Yeah. I think calling your council member is going to be the most important thing you can do to help right now. If you go onto the New York City Council website, there's a search button where you can find who your council member is, and you can call their office and just let them know that, you know, you're a constituent and you believe that Intro 1927 is important because of, you know, whatever the reason is that maybe I've said or you've heard about that has resonated with you. I think the more council members hear that there's support for this bill, the harder it's going to be for them to justify voting no.
Yeah, yeah. Well, thank you for that beautiful overview of what we're working on right now and what we're seeing and what our members are seeing and what they need. Before we end the interview, I do want to touch really quickly on the Value in Housing campaign. We talked to Amy about this before, but can you give us an overview of the Value in Housing campaign and then what we're seeing right now as we move forward into this next chapter, and really how all of these moments by COVID-19 have highlighted so much inequity that has already occurred in our city before this, and so much of our work that we've already been working on. Can you talk more about that?
Definitely. So the Value in Housing campaign was born out of Neighbors Together's members. You know, a number of our members have rental assistance vouchers. So these are like subsidies that help pay rent in New York City, especially in a high cost market like New York City. Vouchers are super helpful for helping people find stable housing. And the issue with vouchers, especially city and state vouchers, are that the programs are just designed so poorly that they end up really not helping anybody. You know, you'll get a voucher from the city, it's called City FEPS, and the first thing you'll notice is that the voucher falls about $400 below market rate. So just for context, somebody who wants to, is an individual, they get a voucher for $1,268. So if anyone's interested, go to Trulia, go to StreetEasy, go to Zillow, type in 1268 and see what comes up. And just remember, you cannot rent a room with that. It has to be an apartment. If you're renting a room, your budget is $800. So it is really hard for folks to find housing. And then even if they do find an apartment that is in the voucher range, landlords and brokers across the map discriminate against people with vouchers. They stigmatize them. They think they're going to be bad tenants. They don't want to deal with government programs. And so they will figure out ways to get around renting to that person, whether it's they tell them no to their face, whether they ghost them, they stop answering any texts or calls, they tell them the unit's taken, whatever it may be, just to get them to not apply. And so a lot of our members were getting these vouchers, feeling excited and hopeful, and then realizing after, 2-3 months of failure that their situation was not getting any better, and it was very unlikely, or it felt very unlikely, that they were going to find housing. And so we started a campaign addressing both source of income discrimination as well as administrative and bureaucratic problems with the voucher programs themselves. And our members came up with the entire platform. We had a number of policies on there that we were going to fight for and push this year. And one of our platform pieces was to increase the vouchers to be fair market rent.
Right.
So if anyone's ever heard of Section 8, it's a federal program. Section 8 vouchers pay fair market rent, and they are typically, they still have to deal with the discrimination, but they are typically much more successful at finding housing because there are just more options available.
Yeah.
And so we were fighting really hard with Value in Housing to pass a bill called Intro 146. And that bill would have raised the city FEPS vouchers to be fair market rent. And we had a lot of momentum. It really looked like we were going to be successful. The bill had veto-proof majority. We were kind of working on negotiations around the budget. And then COVID-19 happened. And like so many people's plans, it just really threw a wrench in our organizing work. It became really difficult to talk about anything besides COVID-19 for a long time. And now that we're, starting to kind of see the light at the end of the tunnel, it's a new light. It's not going to be the same as the old light, but we're seeing, massive budget shortfalls at both the city and state. The state is predicting an $11 billion gap, I believe, $60 billion over 4 years. And the city is predicting a $3.5 billion gap this year. And so, we were reaching out to some of our allies and talking about their thoughts around our bill, Intro 146, to increase the vouchers. And, universally the response back was, it was possible before with the way the budget is now, and this is a reality. Social services are always the first ones to get the cut. And it's very unlikely and tone deaf to continue to push for Intro 146 because there's just no money now.
Yeah.
And it is unfortunate because when you think about it, so many people are in shelter because their vouchers don't work. And they could be in housing and using their voucher, while the city is spending, billions of dollars to keep people in shelter. It feels like, there is a cost saving argument that people just can't see that long term, especially right now. And so we've really had to, step back and reassess and figure out where we want to direct our energy.
Yeah.
And that's going to depend entirely on our members. If our members tell me, no, I want to continue to fight for this, this is the most important issue, then that's what we're going to do. It's, we're working on setting up a Zoom call with as many of our member leaders from that campaign as possible so that we can really, discuss reality and discuss our priorities and see if we want to shift our energy for the year or continue to fight for what we were so close to winning before COVID.
Well, thank you for outlining all of that. And I think it really does highlight the disappointment of, obviously on so many levels, how this crisis has impacted low-income New Yorkers and the homeless population. And voucher holders are being affected, and people are maintaining residence in shelters because they were so close to either finding an apartment or having legislation passed to support them in these ways. And so for those of you who don't know about these issues, we really wanted to be transparent and highlight what we're working on and how this is impacting our members right now on all of these different levels and how it's impacting our work. And, how our programs are member-led and member-driven. Like you said, if you get on a call with our members next week and they say, no, we're moving forward, then that's what we're doing. Because, our members have the answers to what they need, and we can be that mechanism to help drive that forward. And as we're wrapping up, what are some maybe final thoughts or statements that you have around kind of how things have been inequitable before COVID and how things have really, how COVID has just, really brought things to light in this way. I know Amy talked about this, Natalie talked about this, but I think it's a really important thing for us to continue to talk about how these things were in existence beforehand. Do you have any final comments on that before we wrap up?
Yeah, I think, there's the saying that's been thrown around a lot. When America catches a cold, Black and brown communities catch pneumonia. And, due to systemic racism, low-income communities are primarily Black and brown communities. And this virus was not the great equalizer like our governor liked to claim it was. This has really highlighted the really delicate and, unstable, structure of our society and how difficult it is for people who are low income and how often they are forgotten or silenced, or, there's the tale of two cities, right? There's two New Yorks, and our mayor ran on this idea that he was going to end the Tale of Two Cities and it was going to be one New York. And I think, you know, the only thing that I want to say to this is, like, we need more people to be vigilant and to be calling out our elected officials when they are not, you know, doing the work that will make us a more just city and a more just state, because it is happening all the time. It's just, you know, a lot of people get distracted by the smoke screens or the gaslighting that might happen and are not really paying attention to the details and listening to the cries for help that are coming from our, you know, most vulnerable neighbors. And so, you know, I hope that COVID-19 brings a new sense of humanity to people and a new understanding that we're all in this together. And our city can't get better unless all of us are getting better. And so we need to be taking care of one another. And, you know, there's a lot of unjust things happening in New York, a very progressive state. There's a lot of unjust things happening in New York City, the fairest big city in the country. So, you know, I hope that people really start paying attention more and start calling for more equity and, you know, just start paying attention or start recognizing privilege, I think is also really, really important. You know, social distancing is a privilege. Socially isolating is a privilege. And so many people can't do that. And so many people have died because they could not do that. And, you know, just tune in and stay informed and, like, fight with us. That's the thing I would say.
I mean, perfect. Yeah. I mean, and to underline it, just like the campaign says, homeless can't stay home. And, you know, being able to social distance is a privilege, and everyone deserves that right now, and moving forward, the right to housing, because it really is healthcare. And we see such a difference that it makes in our members' lives and in our work and the effectiveness of how we can change these structures and these systems. Annie, I can't thank you enough for being here and for joining me this week for our episode and updating everyone on the work that we're doing and being so transparent and really vigilant in the work that we're doing to make sure our members are heard and that we can forward our mission in the way that we really want to here at Neighbors Together. So thank you so much.
Thank you, Christina. Thank you for everything you do again.
Thanks. So if you want to watch this video next week, tune in on YouTube. We'll most likely be interviewing somebody from our empowerment program to talk about our social services at Neighbors Together and how they've changed since COVID-19 hit. Thank you all for joining us. Thank you again, Annie, and we'll see you next time. Bye, everyone.
Bye.